from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
I'm very pleased to welcome back to our program Dr. Linda Hudson-Buehler, who was with us last week, and she serves as the Dean of Health-Related Professions at the Idaho State University. Our guest also holds a PhD in clinical psychology from Kent State University. As our guest last week, we discussed with her the issue of health care in America today, and we're going to continue with somewhat a different emphasis this week, and this is our third week of the subject of health care. We've asked our guest today to talk about the health-related professions and what is going on in those different professions around the country and our needs, and how that too can serve health care. Welcome back to our program. It's a pleasure to have you with us.
Thank you.
And as always, I'm pleased to have Janelle Burke as a panel member. Janelle is the law clerk for the Chief Judge of the First Judicial District of the state of Idaho, and I shall ask Janelle to commence the questioning.
Well, at the very conclusion of the last program, we talked about some of the crises in healthcare, and you mentioned three in particular. Can you reiterate for our viewing audience those three crises that you consider particularly important?
Well, the point I was trying to make last time is that I would like to see some fundamental changes in the way health care is delivered in this country. And that's well above and beyond simply changing the way we pay for health care. I think we need some system changes. And the point I made first was that we needed to increase access and availability of primary care services, which includes preventative services and early kinds of detection. And I talked about the fact that it doesn't necessarily have to be provided by a physician, that mid-level professionals could provide early screenings and only send individuals to a physician upon referral. My last point had to do with an idea that I have coming really out of my background in the mental health field. I would like to see a much closer relationship between our education system and our healthcare system. I think as I look back and reflect upon my own education, we do better today with health-related education in our schools than we did when I was in school, but we still have a long way to go. And I'm talking about it on two levels. One is curriculum. I would like to see a lot more discussion about health issues, including mental health issues, coping strategies for very young individuals early on, parenting kinds of skills early on, identification of high-risk children, whether it be as a result of child abuse or mental or physical illnesses in their families, and a special focus on those individuals right in the school, rather than having to take them out and put them in a special place in town called the mental health center or the physical health clinic. So we could incorporate it into our curriculum and make those kinds of things as important and as standard routine procedures in schools as our reading and mathematics and those basic skills that of course we need to focus on as well. I would even move the health clinics into the schools. I mean, we have the young children there now for 5 hours a day, 5 days a week. It may be in southern Idaho, we're doing it all year round now. So perhaps move the clinics there as well, to a much greater degree than we do now. And provide primary care health screening right there on the campus of the school, and have that available on a regular basis. Parenting classes could also be available, maybe move child care over there, I don't know, but just sort of a blending and make it a community education / health facility rather than the school here and then the clinic across the street or down the block or whatever. Again, I'm coming primarily from the mental health area here, where I see children with various kinds of behavior problems sometimes removed from the school and put into a day treatment program, which may be across town. And I see the need for all of that to be right there in the school.
One thing I want to do with our viewers is to identify what we mean by health-related professions, and I know you supervise many programs, so if you could both in your position identify those and then tell us what those are around the country as far as serving our health needs.
Okay. Well, first of all, in 1983, the State Board of Education gave lead emphasis to all of the institutions of higher education, the four-year institutions of higher education in the state, and ISU was given primary emphasis as health sciences and health-related sciences. Before I give the litany of all the programs that we have at ISU, I want to assure everyone that that role and mission did not mean that we're the only institution who has health-related programs, because everyone knows that's not true. However, it is true that we have more health-related programs than any of the other institutions. But we always have, and I suspect that that's why we got the role and mission that we did. It was not a capricious decision on the part of the state board. Our College of Pharmacy dates back prior to the institution of Idaho State University, or Idaho Teachers College, and all the other names that it had. Idaho Southern Branch of the University of Idaho. The College of Pharmacy has been around since the 1920s. My school, the College of Health-Related Professions, at other institutions in the country, is often referred to as an allied health school. So it includes 9 different programs at ISU. Many of them are unique in that the only place in Idaho where these programs are offered are at ISU. We have an audiology program. We have dental hygiene. We have dentistry. A lot of people don't know that you go to your first year of dental school at ISU and then proceed on through the Idaho Dental Education Program to Creighton and Omaha. We have education of the hearing impaired, healthcare administration, nursing, both at the baccalaureate and master's level, physical therapy, radiographic technology, and speech pathology. The ISU campus also has programs in dietetics, social work and psychology, which I consider to be health-related but aren't in my college.
Yes, well, thank you very much. As you look around the country, and all of those have very vital roles to play in the care of our citizenry, could you identify those that are best covered as far as having professionals in communities all over the country, and those that have the greatest shortage of professionals to serve our needs?
They're all short. In other words, and all of the projections for the future suggest that we're going to need more and more of these professionals. We talked at the last show about the aging population. If the theory is wrong, and in fact the older people get, the more health care services they will require, then the need for professionals in the health-related areas will continue to grow. We can't meet the need now in all of those areas, and the allied health fields in general will continue to increase in their need. Institute of Medicine study was completed, perhaps 3 years ago now, and the conclusion of that particular study, it was a national study doing employment projections, indicated that the need for allied health professionals was greater than the need for the traditional standard health professions of medicine, dentistry, and nursing is usually included in the big 3. We have nursing incorporated in our school, but that's not the way it is at many institutions. So the point being that the Institute of Medicine study suggested that there was a greater shortage of allied health professionals than in the medicine or dentistry.
From your comments, I have 2 reactions and ask you about those. First of all, because there is a shortage in all those fields, one, does it mean that a number of people go without service or in care that they need because simply those individuals just in the profession cannot cover those needs?
Well, some time ago, I always feel like I'm dodging your questions because I have to answer them perhaps not as directly as I would like to. Some time ago, there was a tremendous shortage of nurses, and the physicians in New York City said that they simply could not practice because there were not a sufficient number of nurses to staff the hospitals where they practice. So, yes, potentially that is the case. If the professionals are not out there, then the individuals are not being served. Or far greater services could be rendered if there were a sufficient number of people.
Just not enough time. You become more like an assembly line with patients in some cases, I would suppose.
Sure, you're spread very, very thin. Let's take physical therapy as an example. The need for physical therapists has increased dramatically in recent times because the situations in which physical therapists are used have increased. People are surviving trauma. Immature babies are surviving now where they did not previously. And those individuals, because they become medically compromised, need more and more services. And so physical therapists are in great demand, not to mention the need for the health-related individuals, the health spa kinds of people who are trying to keep in good shape and employ physical therapists to assist them in that process. So physical therapists are in tremendous demand and spread very, very thin.
My second reaction to your comments was that since there is a shortage in all those fields, I would assume it is very similar to other occupations, that also that affects the cost, more the demand, and also then the more the cost. If there were more people in the profession, would it somehow maybe change in some way cost for care?
It depends on the profession. Some of these allied health professions are employees. They work for individuals or institutions. For example, dental hygienists are employers, are employees of dentists. They cannot, in the state of Idaho, practice independently. Nurses, for the most part, remain employees of hospitals. And those charges then for those kinds of situations are pretty much based on the institution or the individual. Certainly, the supply-demand factors impact those, but not to the extent as those professionals who are in private practice. And physical therapists in the state of Idaho can practice independently, and so their services generally come at a higher cost because they are a rare commodity.
Yes. Janelle Burke.
I suppose that some of our viewers out there may have a young person at home and they may be talking about career opportunities. And so where would you suggest, if you were just going to choose a career, and where would you suggest they might look? What kinds of opportunities are there out there? Are there some bright spots that you can tell us about, something that would be particularly good for a young person?
I think that all of the healthcare fields are extremely have an extremely bright future, and it's only going to improve as we enter the 21st century. I think the thing the viewers need to keep in mind, however, is that we have seen a great increase in the interest in our programs across the state recently. So the competition to get into our programs is probably at its highest ever. Let me give you some examples of what I mean. Because health-related programs are governed by accreditation bodies, we can only accept a certain number of students given the number of faculty that we employ. Also, our class size is limited by the number of clinical sites that we have to train and place our students for their clinical rotations and so on. So most of the 9 programs that I rattled off previously have limited enrollments. Physical therapy, 24 seats per year we accept.
And how many applications did you have?
Last year, I'm glad you asked. Last year we had 187 applications for our 24 seats. Okay, the one caveat on that, and I'm so glad I have an opportunity to talk about this, only 29 of those applications were from Idaho residents. And we must, as a state institution, not accept all Idaho residents, but with candidates of equal credential, we must give priority and preference to the Idaho resident, which means that this is a very good opportunity for more Idaho residents to apply to our programs. As a matter of fact, we are looking for highly qualified Idaho residents to apply to all of our programs, physical therapy being a real good example of that. The more applicants from Idaho we have, the better our Idaho resident application pool is, and the more Idaho residents we can accept. And again, going back to the issue we started with, is that it's very, very competitive. It includes our nursing class, our dental hygiene class. We accept 26 students. We had 90 applicants for our dental hygiene program. So in terms of my advice to individuals, yes, it's a wonderful future, but because it's such a wonderful future, people are trying to get into these professions, so the credentials have to be pretty good, and that means all of the prerequisite classes in the basic sciences need to be at a competitive level with the other applicants.
I found out something through an experience that I had. I'm one of the founding board members of Hospice of North Idaho some years ago. Mm-hmm. And one of the things that impressed me in those years with that organization was that with a patient that we tried to have what I would call very comprehensive care, not only the physician and the nurse, but maybe a psychiatrist and a speech therapist and so forth. Is that something that's very common now to these professions too, that for certain kinds of illnesses that there will be a number of professionals and specialists that will come in to be part of that care?
Hopefully. We're trying to teach all of our students to work in teams, that the human being, whether you be focusing on body or behavior, is a very complex organism. And so what we are trying to do in our clinical experiences is provide our students with a team approach where they're comfortable working with another professional, whether it be a pharmacist or a speech therapist or a psychologist or a social worker, because that's where we're going in terms of the real world. People are not going to be in isolated offices any longer, but depending on where, as some of the topics we talked about last program, where healthcare systems are changed, if we go into a coordinated kind of primary care clinic, it will be manned or personed by lots of different people. So students need to know how to work in a interdisciplinary or multiple disciplinary team.
May I interpret from that answer too that is finding its way into the curriculum and so forth, that as one is studying their profession, they can now look at how they can assist physicians or others in that way?
Yes, we have clinical experiences in which the students take their own perspective. The speech pathologist may evaluate a disabled, handicapped child with respect to speech problems, but there's also a nurse there, there's also a physical therapist there, and so on the team dealing with the child as a whole.
And one final question before I go back to Janelle too, for our viewers who may be facing this and some member of the family, with this team approach, there are regular meetings, is that correct, where the team will get together to talk about each patient and how to deal with it?
And staffed together, and the decisions on the treatment program is made as a team rather than as individuals who don't know what the others are doing.
Surely. Janelle Bird.
Mm-hmm.
Last time we talked somewhat about the prospect that in the future there will be more mid-level care for individuals. And can you talk about that a little bit and how the professions that you are training for fit into that total scheme of things?
Well, I said that in the context that I hope there will be. That's my perspective on where we ought to go. Don't confuse that with the truth, nor with what is actually going to happen. But I certainly hope that's going to be what happens. So the impact of that is that we would have somewhat of an inverted triangle. Right now we sort of have the physician on the top of the pyramid, and I see the future being a leveling of that pyramid where a number of professionals are sort of on the same level and working together as a team with just different areas of focus.
And so that, let's take, for example, the area of dentistry, perhaps. How would this work out so that individually a person would probably see the hygienist first, and then the dentist at a later time?
Right now, the interesting statistic nationally is that there is approximately, and the statistics in Idaho are similar, there's approximately 0.5 dental hygienists to every dentist. In other words, fewer dentists than there are, fewer dental hygienists than there are dentists. I predict in the future, or I would like to see in the future, that ratio flip-flopped such that there are perhaps 2 or 3 dental hygienists to every dentist, such that the initial contact at the system would not be the dentist as it is now, but with a dental hygienist. Now, before all of the dentists in the audience get to their phone and call me to tell me that I'm after their jobs, let me say this, that I see the profession of dentistry as changing somewhat of its focus in the future. I think that dentistry has a tremendous need with medically compromised patients. I think that dentists need to work much more closely with physicians in hospitals and be right there with some of the cardiac patients, with some of the cancer patients, much more than they are now, and that they will be allowed, or they will have the opportunity to do that if they're not always in their offices dealing with rather routine kinds of matters, and they can use their time more efficiently and their expertise more effectively if other individuals are doing routine exams. Dental hygienists do not do fillings and restorations and so on, and probably never will. But nonetheless, they still can do some initial assessment and clearly all of the cleaning and the prophylactic work needed for a dental patient.
Now, I also want to give you an opportunity to talk somewhat about mental health. We have not really covered that area, and I would like to give you an opportunity to address the audience with regard to the needs of mental health.
Well, yes, the focus in mental health initiatives these days are on the seriously mentally ill, and the goal is to try to do a better job of keeping mentally ill individuals out of institutions. In the 60s, you're aware there was a great initiative to do that, and what has happened subsequently is we have now a great number of people who are homeless and on the streets. And what the trend is these days in mental health care is much more outreach. Speaking of team approach, what we're doing is initiating assertive community teams. They're called ACT teams that monitor people in the community on a daily basis. It may include administering their medication while they are living in the community, perhaps independently, perhaps in a group home. They watch them, make sure that all of the resources they need, whether it be employment or other kinds of supports, are there such that they can function, but in a high quality of life rather than a marginal quality of life in the community. And the only way we can do that is to get the mental health professionals out into the community. So no longer will you see lots of people coming to the community mental health center. Instead, you'll see the workers there going out to the individuals in their homes and in their residences in the community on a daily basis. In some cases, the ratio of mental health workers to patients is in some cases 1 to 10, 1 to 20. In other words, a small group of mentally ill individuals are managed by a team of individuals who are on call 24 hours a day, 7 days a week. So whenever they're needed, they're there and can help. And it's that kind of system we think is going to do a much better job than what we have done in the past in keeping individuals in the community.
Certainly something that's coming through clear to me is that with your health-related professions, a part of that time is spent in preventive care. That is, that if we do certain things, and again, if we get into the dental area, that if you do certain things or in your nutrition and diet and so forth, we could prevent a lot of illnesses, and therefore the person would have a healthier life, and also medical costs would be less expensive. So would you like to address how those particular professions are doing a better job in contributing in that area?
Well, the allied health professions traditionally have based their expertise in prevention. If you look at dental hygiene as an example, that's the primary purpose of the dental hygiene profession, is prophylactic kind of work. Nursing as a profession also has a great deal of emphasis on prevention. Patient education. It's the nurse that sits down with you and talks about home care and how to handle yourself after you get out of the hospital and so on. So they also do a lot of home care education with people in their own homes. So the allied health professions have a long tradition of emphasis on prevention, and yeah, I think that's another indication of why we're going to need more allied health professionals in the future. If, again, my hopes are realized that we focus as a country much more on preventative health than on acute care.
Dr. Linda Hutz-Buehler, we're so happy that you could be with us for these 2 weeks. And ladies and gentlemen, our guest is the Dean of Health-Related Professions at Idaho State University, and you have shared so much very valuable information to our viewers, and you've been very, very gracious with your time, and we're very grateful that you could be in Coeur d'Alene with us.
It's my pleasure.
And Janelle Burke, once again, thank you for your questions.
Thank you.
Ladies and gentlemen, this concludes a 3-week series that we've been having on the issue of health care. We hope it has been as helpful and informative to you as it has been to us. And I would like to invite you to be with us again next week at this same time, when we will discuss another issue that we believe to be significant to your life. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Telemedia Services on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.